Hi, my name is Mark Harris. What is Medicare really? Utah edition. Quick question. If you live here in Utah and you've heard the word Medicare a million times, do you actually know what it is? Most people don't, and that is totally normal. So today I'm breaking it down super simple Utah style. Here is the most basic way to think about Medicare. Medicare is simply health insurance from the federal government, mostly for people who turn 65 or for some people under 65 with certain disabilities. But Medicare isn't just one thing, it is actually four parts: Part A, Part B, Part C, and Part D. Think of Medicare like four different pieces of a puzzle that fit together to form your health insurance. Part A helps with hospital type cost. Part B helps with doctor visits and outpatient care. Part D is for drug coverage, and Part C, also called Medicare Advantage, is an option where you get Medicare coverage through a private company instead of through the federal government. That's it. Four pieces, simple as that. Now, why do Utahns get so confused? Here in Utah, Medicare can feel extra confusing for a couple reasons. First, Utah is one of the fastest growing states. A lot of people move here from out of the state, and the Medicare options here in Utah look different than from the state they moved from. Second, we have a mix of rural and urban areas here in Utah. For example, someone in Salt Lake has completely different access to doctors and hospitals than someone in Cedar City or Vernal, and that affects what type of Medicare options they might consider learning about. And third, many Utahns work past the age of 65 at places like Hill Air Force Base, Intermountain Health, the state, and University of Utah. And they're not sure whether they need Medicare yet or how that works with their current employer coverage. So, if you are feeling overwhelmed, trust me, you are not alone. Here is another key thing to understand. Original Medicare, Parts A and B, helps cover a lot of medical services, but unfortunately, not everything. For example, Medicare does not automatically include dental, vision, hearing aids, or drug coverage. That's why people often learn about additional coverage options. But for today, the important thing is this: Medicare has gaps, and understanding those gaps is what helps you make smarter decisions later on. We'll go much deeper in future videos. So here's what I want you to take away from this first video. Medicare, original Medicare, is federal health insurance. Medicare has four parts. Utah has many unique factors that make choices look different depending on where you live and whether you are still working. No one should feel confused because when you understand the basics, the rest becomes a whole lot easier. Remember, this video is just for general Medicare education, not specific to any plan or company. If you're in Utah and you want help understanding how Medicare works in your situation, feel free to reach out. My information is in the box below. I'm a licensed independent Medicare agent right here in Utah, and my job is to simply educate first. Make sure to follow along. In the next video, we are going to talk about when you actually qualify for Medicare and the exact timeline Utah residents need to know. Remember to like and subscribe and follow this channel to learn more about your Medicare options.